Good morning, everyone. Today, Dr. Ishani Pandey, will be presenting a seminar on the topic Yoga and Mental Health under the guidance of my moderator, Dr. Sanjeevani. So, yoga is a spiritual discipline based on an extremely subtle science which focuses on bringing harmony between mind and the body. It is derived from the Sanskrit root yuja, meaning to unite or to integrate, and is a means of balancing and harmonizing the body, mind, and emotions. It is done through the practice of asanas, pranayam, mudra, bandh, and meditation. Now, how is yoga related to our health? According to the World Health Organization, health is defined as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Now, currently, the dimension of spiritual health has also been suggested to be incorporated in this definition as well. The yogic concepts of disease. From the yogic viewpoint, it can be seen that psychosomatic stress-related disorders progress through four distinct phases. Firstly, the psychic phase. It is marked by mild but persistent psychological and behavioral symptoms of stress like irritability, disturbed sleep, and other minor symptoms. The psychosomatic phase. If the stress continues, there is an increase in symptoms with the appearance of generalized physiological symptoms such as hypertension and tremors. This is then followed by a somatic phase, which is characterized by a disturbed function of organs, particularly the target or involved organ. At this stage, one begins to identify the diseased state. And finally, by the organic phase, which is marked by full manifestation of the diseased state, with pathological changes such as an ulcerated stomach or chronic hypertension manifesting in their totality with their resultant complications. Now, how is yoga incorporated in psychiatric disorders? There are various studies done in this aspect, namely by Pilkington et al. In 2005, he told about the potentially beneficial effects of yoga interventions on depressive disorders, followed by Gupta et al. In 2006, who talked about yoga-based lifestyle interventions that reduce both trait and state anxiety. Then yoga therapy had better efficacy as an add-on treatment in schizophrenia when compared to physical exercise. This was told by Duraiswamy et al. In 2007. There was a randomized controlled trial consisting of 30 patients in depression. This was a 4-week long study, and SKY, which is the Sudarshan Kriya Yoga, proved to be efficacious. Then dysthymia, 45 patients with dysthymia were given a trial with again Sudarshan Kriya Yoga, and out of this 25 had remission at 1 month and maintained at 3 months. Kundali Yoga proved to be much more efficacious than mindfulness meditation for improvement in OCD and anxiety, although the sample size was small. This was followed by schizophrenia, where a systematic review of 3 RCTs showed improvement in positive, negative symptoms, and general psychopathology. Then a recent study in NIMHANS also showed improvement in negative symptoms, social cognition, and elevation of oxytocin. Another study done for alcohol dependence syndrome, an RCT consisting of 60 patients, they were also administered again the Sudarshan Kriya Yoga, and even their cortisol and ACTH levels were shown decreased. These are a few asanas that are done for Kundali Yoga. Now, approaching the neurobiology of yoga, we'll be talking about a few possible mechanisms. Firstly, autogenous subconvulsive seizure. Studies showed that in healthy volunteers, seizure-like EEG pattern was elicited while practicing the Sudarshan Kriya Yoga. However, this was not associated with any clinical seizure. This was hypothesized to act in a similar manner than to the induced seizures used against depression, for example, in ECT, and hence the antidepressant effects thereof SKY, which is Sudarshan Kriya Yoga. 3 weeks of this practice by a group of depressed patients also resulted in significant reduction in cortisol and a concomitant decrease in depression scores, as told by Gangadhar et al. In 2000. This also caused significant transient elevation in prolactin levels in male subjects, and this could be due to subconvulsive seizure, as talked about previously. Now, the tumor necrosis factor alpha levels decreased after regular yoga treatment, but due to the small sample size of the study, conclusions need to be drawn very carefully. The neuroplastic antidepressant medications as well as ECT elevate these levels, and a study recently completed at NIMHANS showed an increase in this factor after regular yoga practice. Then oxytocin, a recent study decreased oxytocin levels as told by Jairam N. 2010. But oxytocin may also be the mediating mechanism for improvement in regulation and also bringing and maintaining a feeling of well-being. A testable hypothesis is that Sudarshan Kriya Yoga also increases the release of oxytocin. Cortisol reduction. Elevated cortisol level is a feature of depression and anxiety. Yoga has shown to decrease cortisol levels by different researchers. Stress has a deleterious effect on hippocampus and other limbic structures. Yoga, thereby reducing the cortisol levels, also has a neuroprotective action. Talking about the vagus nerve afferent stimulation, indirect evidence has shown that this may be one of the...
You're not audible.
Hello?
Your voice was breaking in between.
Sir, am I audible now?
Yes. Yeah.
Now, hormonal changes induced
Go to the previous slide. Go to the previous slide.
Vagus nerve afferent stimulation. There is indirect evidence that this may be one of the mediating mechanisms for the therapeutic effect of yoga. The vagus nerve afferent stimulation induces antidepressant effect and is an approved form of treatment in select population. Hormonal changes induced by TM, which is transcendental meditation, mimics the effects of GABA. Transcendental meditation produces changes in pituitary hormone secretion by enhancing the hypothalamic GABAergic tone, and its anxiolytic effects may be mediated by promoting GABAergic tone in specific areas of the brain. This is analogous to the effects of endorphins in runners, as told by Elias and Wilson in 1995. Now, acute elevation of brain GABA levels following the practice of yoga asanas in experienced practitioners suggests that these asanas may be an efficacious treatment for low GABA states such as depression and anxiety disorders. Streeter et al. 2007 claimed. Now, what are the various serum concentrations and how are they changed during meditation? So arginine, vasopressin, melatonin, and serotonin, their levels are increased. Norepinephrine's level is decreased. Beta endorphins, although the levels remain unchanged, the rhythm is changed. How are they relevant to us? Arginine vasopressin contributes to maintenance of positive effect. They decrease the self-perceived fatigue and improves the consolidation of new memories and learning. Melatonin, wherein contributes to calmness and decreased awareness of pain, and increased serotonin levels, as we are all aware, correlate with a positive effect. Like everything, yoga also has a lot of negative effects. Let's talk about them. Despite yoga being a safe and low impact type of exercise, it can have a negative impact. Joining a yoga class beyond one's level of ability can result in injuries like pulled muscles and pain, and it could also be a blow to one's self-esteem if one is unable to do the asanas as well as the others. So one is always advised to start as a beginner and work their way up to more difficult classes and poses. Inverted poses along with fast pace or flowing yoga should not be practiced by beginners. In acutely psychotic and actively suicidal patients, practice of yoga may be detrimental. What does the future hold for yoga? Yoga as a treatment is yet to be established in standard medical care. Currently, it is available in only a few tertiary care centers. Talking about the other issues which need to be considered and addressed for future research, firstly, the classification currently of mental and physical illnesses are based on allopathic understanding of mind dualism and not from the yogic concept of body-mind interaction. Secondly, until date, yoga research is usually conducted in a single center, which is usually a specialized yoga center, which limits its inclusion into routine practice. Therein, multi-centric trials are required to examine not only the efficacy, but also the effectiveness of yoga treatment. Finally, yoga, as we all know, is an art and science of healthy living, and it facilitates an individual's accomplishment of liberation or emancipation. Yoga practice may specifically help persons with mental illness in at least 5 ways. It can give them a calming effect, it increases their awareness, it can increase their attention span. Then it also gives them a sense of acceptability and adaptability, wherein if they are adequately rehabilitated in their homes, an unhealthy environment can cause a relapse. Certain ideas of acceptance and adaptability, which are a part of yoga counseling, help the subjects to make a good transition from this therapy center to the world outside. It also gives them a sense of security. For example, bhakti yoga or any form of devotion or surrender to a supreme entity will be a great source of strength to the patient. A significant direction has been provided by a group of studies in the areas of depression, schizophrenia, and other mental disorders. Some studies support in the direction of developing specific and generic models to validate the same, and a large number of registered clinical trials with ICMR are evidence in this direction. These are my references. This brings me to the end of my seminar. Thank you.
Dr. Ishani, can you go to a second or third slide, please?
Yes, sir.
The next slide, the next slide, the next slide, next. Okay, next. Next. Okay, one more. Yes. So can you actually tell me any types of yoga? Like there are different kinds of yoga and its correlation with mental health.
Yes, so this Sudarshan Kriya yoga that I've talked about in this entire presentation, it is a series of rhythmic breathing exercises and asanas. It constitutes of pranayam and holding their own positions for 3 to 4 minutes. This has been known to help reducing the levels of cortisol as it reduces
Yes, that you have shared. My
Yes,
whole
sir.
point is that overall,
Yes.
in the context of a presentation,
Yes, sir.
whether various different kinds of yoga, like mindful-based yoga, and there is something known as Hatha yoga, which is based on more, power dynamics or
Yes.
exercise-based yoga.
Yes, sir.
So whether these categories have been seen, or there is the most of the studies are have concentrated on these model-based treatments like Sudarshan Kriya, because it has a structure.
Yes,
Or
sir.
someone has tried to see different types of yoga and its impact on mental health.
So I haven't seen the different schools of yoga, only the studies which have come in.
So
And
any disorder you would like to recommend yoga as a treatment for any psychiatric disorder, which one, as per your presentation and your whatever you have read?
So for example, in mild depression and in generalized anxiety disorder, we usually tell the patient to have dietary modifications as well as to exercise more. So if the patient is unable to go out and have more physical work done or exercise, we can always suggest them for yoga breathing exercises like Brahmari or chanting Om or this pranayam exercises.
Sudarshan Kriya has also pranayams in its protocol.
Yes, sir.
Okay. And one point it was really pleasing to hear was that low GABAergic states, and it results in acute elevation of GABA, the
Yes.
yoga, and low GABAergic states like depression, anxiety, then
Yes.
they frequently benefit. One section where you have said that TM, just can you go to the slide and explain it again?
So that
Because,
is transcendental meditation. That is
acha,
a form of meditation.
right.
And so that is transcendental meditation. That is a form of meditation. And that is achieved after practice for quite some time. Not always in the beginning. In the beginning, the patient or the person is always asked to chant Om and other things which are going to help them concentrate better and they're going to make them focus better. Only
Can
after
you
that,
explain, can you explain what is transcendental meditation?
the transcendental meditation,
It
so
is like,
according to my understanding, sir, the meditation which, so after a little time of practice, the meditation that you can achieve, the point of so spiritual relevance that you achieve after some point of
okay,
time
so more
of
of
practice.
a mystic state which you will need
Yes,
time and like concentrating on some chakra or something, maybe that kind of a thing.
yes.
And what is the subconvulsive seizure? What's the interesting phenomena you mentioned? Please, can you elaborate on that?
So
This
according to the
autogenic
data that I've
subconvulsive
shown,
seizure.
sir, in
Yes.
this there was sir, after the practice of, sir, in regular people who practice this Sudarshan Kriya, there was shown EEG like pattern,
Mm-hmm.
seizure like pattern in their EEG, which
Mm-hmm.
and but this was not followed by any, sir, physical कोई seizure abnormal body movement की तरह elicit नहीं हुआ था, sir. So this was termed as an autogenous subconvulsive seizure, and this has been hypothesized to act in a similar manner.
So very interesting because long back I attended a yoga camp where actually I saw one patient throwing a seizure. He had an epilepsy. He was on regular treatment. He was on regular drugs, but he threw a seizure there and there itself. Maybe somehow it's related to this. But then at one point of time, we are seeing acute elevations of GABA. And then one point of time, we are seeing subconvulsive seizure. Acute elevation of GABA should be anti-seizure neurobiologically. So how you will explain it?
Yes.
I think this contradictory. Maybe
Yes.
we have to look into it in more details.
Yes.
I think I'm done. I'm done. Any other questions, comments? I think Utkarsh sir is there. Good morning, sir. Sir, any sir comments from your side, sir?
No, Dr. Shobit, I actually joined very late. I
Yes,
just
sir.
read your message at 9:25. So as soon
Yes,
as
sir.
I joined, I could only hear the last
Yes, sir.
few 1 or 2 slides. But
Yes,
what
sir.
I get is that all these practices will here to achieve better physical as well as mental health,
Yes, sir.
or as well as spiritual health. As per the definition of good health, it is
Yes, sir.
not only the physical health, mental as well as spiritual health. So
Yes, sir.
that contribute a holistic
Yes, sir.
perspective in overall health.
Yes, sir.
So I am right now doing yoga, so I can understand the way how the things are changed in your life when you practice those things. It is not the thing which you just say in a seminar or in a talk,
Yes, sir.
or there may be some studies, but when you practice it, you realize that, and you can feel the all these neurochemical changes
Yes, sir.
which are there in your body, as has been elaborated in this many studies. You
Yes, sir.
can actually feel the content. You have a good and sound sleep. You don't
Yes, sir.
have good pains which you perceived previously. Mentally, you feel more comfortable, more confident, and you have. So all these things are basically you can yourself appreciate the biochemical or neurochemical analysis is a subject of research and study. But yes,
Yes,
I
sir.
can say that we should all practice. Even in regular, it is a more primordial prevention rather than treatment. Yoga is a type of practice which if
Yes,
we
sir.
adopt, we can prevent even the risk factor which are going to cause all those mental illness or the physical illness, whatever you can, heart disease, and so many things are there which are
Yes, sir.
coming nowadays. So it is a good session, but I apologize because I could not join early. I read your message a bit late.
Okay.
Thank
So
you,
your,
Dr.
your presence was very encouraging, sir. Thank you for your encouraging comments. Thank you, sir.
Thank you, Dr.
Any other questions, comments? From senior President, Dr. Akriti, Dr. Priya, Dr. Mantaz. And then to top it all, there is one, NEMHANS has started one fellowship course in yoga and mental health. And it is, I think it is a center of excellence, and it is working, and it will be churning out few more papers,
Yes.
the publications in this area. And this is the area which needs more explorations. I wish Dr. Silky had joined this presentation because she is working in PhD thesis. I think she has modeled her thesis on Sudarshan Kriya only, and she is testing it out in opioid dependence and alcohol dependence. I wish she could have been here. She could have shared her experiences, the pilot which she's doing. Anyways, very good presentation, Dr. Ishani. It's a difficult topic because you don't know how to assimilate the information, and you have gone through the basics, the evidences, the neurobiology, subsequently the future explorations, and the time frame which was given to you, and maybe different types of yoga, and few more, the additional 2 to 3 slides on the evidence. And there is an international journal of yoga where a lot of material is published. It's a very good index journal. That can be a good reference, but it was a fulfilling session. Thank you.
Thank you, sir.
Thank you, everyone.